All right. So we're going to hear from Noshima in just a minute. And but we're going to start out with a icebreaker. Using the chat. For those who missed the icebreaker last time, you really missed a treat because it was all about how we handle black hair and our black hairstyles. And it was, would you rather this or would you rather that? It was hilarious. For those, there are several folk who were on the call who last week and back this week. But if you would write in the chat, here's one question for you. If a genie grants you three wishes, but none of those wishes could directly benefit you, what would they be? If a genie, this is the hard one, the next one will be easier. If a genie grant you three wishes, but none could directly benefit you, what would they be? Put them in the chat. Let's just see the responses coming in. Taylor, you think that's a benefit for you? That's so not right. If a genie grants you three wishes, but none of them could directly benefit you, what would they be?
So I have a question.
Yes.
You said directly, so that's the operative word for me because when I start thinking, I'm thinking that, oftentimes benefits could indirectly benefit.
Absolutely.
So, okay, all right. I just want to make that clear. I just want that clarity. Thank you.
Yes. And y'all, this is okay. Very good. More services for mental health. Mental health again. Healthcare. Maggie, I feel you. Homelessness, yeah. Okay. Oh, my mom don't get older. That's a good one. Health and wealth, confidence. World hunger. Those are great. Those are great. And there's certainly a trend. Certainly a trend in the responses. Yes, amen, Rashida. For sure. Well, thank you for that. Second question. This one is a little easier to handle in food insecurity, really, absolutely. Second question. What old person thing do you find yourself doing? What old person thing do you find yourself doing? Reading. You don't have to be old for the reading glasses. Who else? Praise the Lord to sit down after work. Family sayings. Anyone else? What old person thing do you find yourself doing? Going to bed earlier. Singing old hymns. Right? Sitting on the porch. Chase, rubbing my feet together. declaring more what the Lord said. And y'all can turn your, it's awful quiet. I'm just reading this. So if you got some comments, you can come off mute. Saying these kids today. Telling the kids to stop holding the door open. Yeah.
I was going to say, just not recognizing the music on the radio. It's like, what is this?
Right. That's definitely me. Definitely me. Thank you. Thank you. Thank you. I appreciate that. Just wanted to see where what people were thinking and sort of just breaking the ice a little bit. We're going to keep on moving. More related to our topic tonight. Put in the chat as well, what questions did you come here with? I'm so happy to see you all. And again, based on the topic, I wanted to, if you came with some questions, just put in the chat and let us know what questions did you come here with. And you can, I'm going to go on and you can just continue to put those in the chat. Questions or comments or just whatever interested you in tonight's session. If you wouldn't mind putting that in the chat as well. So the reason I came up with topic, because series of topics, and again, I do this, let's talk about a series once a month. And the reason this one came up is, of course, as a minister, preacher, teacher, first lady, counselor over the years, women's ministry leader, I've heard from a lot of women over the years, and I've spoken with a lot of women over the years. And it always surprises me at several things. One, how much I hear doubt, how much I hear people stuck in situations that they probably don't necessarily have to be stuck in. People's thinking being very limited. People in codependent situations and relationships that one, they're not even aware that they're in that type of codependent situation and it's not serving them well at all. Women who have been, don't see their own potential. To me, if there's anything that really gets me is to see a woman, a young woman or old, but particularly young women who don't recognize their own potential. So they continue to play small and don't have the confidence to move forward and to live life as, vibrantly as they could and can. Again, over the years, just women being in that place of defeat and being okay with it and thinking that that is the only solution for them at that particular time or moment. But, the goal of today is sharing not only for ourselves, but sharing more broadly all about women, how we can learn to live our best lives. And of course, for me, it always starts with Jesus. It always starts with our faith and starts with our belief. And, the Bible gives us many, many scriptures already around, I say the Bible gives us scriptures as well as tools to help us live our best life. It gives us instructions and guides, and it tells us sort of some do's and don'ts. It gives us promises, and Jesus is there as our refuge and our strength and our peace and all those things for prayer, to approach and to ask for guidance and all these things. But in addition to Jesus, and if anyone wants scripture, I can give you a gazillion. That God really does want us to live a life, our best life. But even sometimes in those situations, whether we need, physical healing, mental, emotional, whatever it might be that we need guidance, clarity, direction, vision, purpose, whatever it is that we might need in our lives, I think we sometimes forget that God can use and will use multiple ways to help us get to those solutions or help us get to that place of healing in whichever way that it might be. And we tend to be okay with most people going to the doctor, going to an MD when something is wrong with us because we may be hurting in our bodies or, we want to live, at least physically live. but we have trouble seeking out other means to help us live our best life. Hence our topic for today, Jesus therapy and coaching. So with that, I want to introduce Noshima, who is our therapist for the night. Of course, I'm a certified credential life coach, and Noshima is trained in coaching as well. And we want to pose this question to the group and hear your thoughts and hear your questions around why do you think we have trouble? Says that's my mama. Okay, Noshima's daughter is obviously here on the call. Why do you think we have trouble? And I'm going to say believers going to some other sources to help us live our best life. And maybe that's not even the first question. Maybe the first question is, do we believe that we should be living our best life? Or at some point, do we give up, or do we stop, or do we think this is all that life has to offer us? So let me go back to the chat a second to see what everyone said they came for. The topic. So when in therapy, some say I'm not a believer. How do I handle these types of comments? Okay. So yeah, how do you know you need therapy? Okay, Vita, we'll talk about that in just a minute. So Noshima, I'm going to pass it over to you and give you a chance to just introduce yourself for one, and give any comments that you want to offer.
Yes, hi, well, welcome. Good evening, everybody. So glad to see all of you, even the ones that I can't see your faces. I'm grateful that you are here. And I'm a licensed clinical social worker, and I'm in private practice. I'm in a practice in Garner with my husband. My husband is also a licensed clinical social worker, and I've worked a varied social work career. I've worked in community health, I've worked in research, and made the transition to working in private practice about almost 3 years ago. So I kind of transitioned, but I've been working with him primarily for 3 years in our practice. And the other thing that we do is we train and I help assist by coaching other therapists on a particular therapeutic technique that we use primarily in our practice. So we see the gamut of everyone pretty much in our practice, from ages as young as, I think our youngest client is 6. I don't see the kiddos. I mostly treat 18 years and older, mostly women, and also couples, but we see ages 8 and up primarily in our practice. And my husband works mostly with the kiddos. He has a background that's been in community mental health and all over the triangle for years. So he still gets a lot of referrals from people that know. So that's how we get a lot of our young folk and our children in our practice. With regard to therapy, when we think about our spiritual faith and then therapy, and our faith being questioned because we're seeing therapy, one of the things is related to the stigma that's kind of already been alluded to with Minister Blake sharing about, we'll go to the doctor, for a medical condition. We may take the medication, but yet something stops us. And now generationally in our community, not everyone, but most of us, we've had some sort of stigma around mental health, whether it be the language. If you're going to talk to someone else, you must be crazy. Now we have all the terms that we have people that are overusing a lot of the mental health terms, such as gaslighting, someone's bipolar, and really misusing the terms that it puts a stigma on it. So anything that has that negative connotation and stigma, we don't want to be a part of that, right? So that's primarily one of the main reasons why I think in our community, we have so much stigma around mental health. The other thing of being weak, we're people that we've overcome being enslaved people, how we were brought to the US. So we're sometimes in some communities, sub-communities, we're deemed as weaker than if we need someone else to talk to. Then we have the whole taboo of talking about our family issues with someone else, a stranger. So that's some of the reasons why I think people don't seek out therapy. And then another thing is sometimes people don't really understand therapy and all that therapy encompasses. There's, some overlap between coaching and what therapy offers, and there's some overlap with regard to someone's spiritual belief. I know when I start with couples, I let them know right off the bat, you're not going to get one type of approach. You're going to get an eclectic approach. You're going to get some spiritual stuff. You're going to get the book stuff and all the educational stuff. You're going to get experiential from my personal experience of being married for 30 years. You're going to get some things that I've seen with other couples. You're going to get all of it rolled into one. Take what you need and that you agree with, and the rest, do like you do when you go to Walmart. Leave it in the store. So that's kind of my approach with it. I know we're going to talk more on coaching and how they overlap in some of the other differences, but I'll leave it there. Handling that in a way, and also guarding. I would guard what I share with people about what services I'm in, because everyone, they don't understand necessarily what therapy is, but letting them know that my faith isn't any weaker because I'm seeking assistance. And I have another t-shirt because I couldn't decide. I knew the topic was Jesus therapy and coaching, so I got the one with Jesus on it. But I have another one that says, God made therapists, it's okay to see one. So that's a nice statement too, that you can share with someone. And it kind of makes it a little light, to just say, God made therapists, it's okay to see one.
And I don't know if everyone can see her shirt or not. It says it's okay to have, what does it say on the bottom?
It's okay to have Jesus and a therapist too.
Yeah. And I told her, my daughter made this one for me, his Jesus therapy and coaching and the check marks. So likewise, it's okay to have and take all that you need. But Noshima, before you stop, and as someone posts a question in the chat, can you talk a little bit about what is therapy and how might someone know that therapy is needed?
Okay, sure. Yeah, so therapy primarily is usually made to manage, help improve someone's functioning based off of either a clinical diagnosis or symptoms that they're having. And how you know if you need therapy is if you're having these symptoms and if there's a behavioral or emotional change that impacts your life for at least 2 weeks, you probably should see someone. Now, I'm going to say that again, because it almost sounds like we can be running to therapy for anything, and we almost can. But when you think about it, if it emotionally and behaviorally impacts your life for at least 2 weeks where there are changes, you probably should see someone. It could be something as simple as an adjustment disorder, right? So an adjustment disorder is a diagnosis that's given when we have this symptomatology of changes that happen and it's less than 6 months. So let's say there's a job loss in the family. And with the job loss, there's worryation, frustration about whether or not financially the family is going to be able to sustain. And it's been a couple of months and there's still some anxiety around that. It doesn't mean the faith is gone and you don't have faith that it's going to happen, but how do you manage this anxiety when it's the unknown of when a new job may come? So in that instance, therapy may be something that can assist with the symptoms around anxiety. The other thing with the symptoms, if there's a marked interpersonal relationships type of issues related to the symptoms that you're having. So the worryation is now causing anger towards your spouse or towards your family member, or you're projecting what you're feeling onto your family members. That may be a reason. to come and seek therapy. It may be a DSM, the Diagnostic Statistical Manual of Mental Health Disorders. It may be a diagnosis that's in the manual, but now the book, the way we can treat and even people can receive reimbursement for their insurance is we don't always have to use the stronger diagnoses. There are some diagnoses that you can use, such as family problem or things of those natures that are less stigmatizing. Usually there is a clinical focus to get someone back to what their normal functioning is. And the reason why I say 2 weeks is because when we look at things like major depression, we have a lot of dysthymia in our community. And what dysthymia is, it's a low level rate of depression that someone has, and you can have it for years and not know. So it could be something like just a low mood or kind of like melancholic or kind of negative low mood. The person may go to work every day, but when they come home, they're isolating, they're not going out, they're not doing anything for social, for fun or anything. They're home and they're doing the minimal, which is go to work and that's it. So they may have negative thinking, they may have, thoughts of, man, what's the use of me being here? But maybe because of their faith, they would never, do anything to harm themselves. But those are some of the things that are very prominent in our community. And depression and dysthymia looks different from person to person. Sometimes just irritability and that anger is how people express whenever they're depressed.
Great, thank you. Thank you. And everyone, please feel free to put any questions you might have in the chat. So any other questions for Noshima in terms of what is therapy and how might someone know that they may need to see a therapist? Any other questions for her on that topic?
Can I ask a question?
Yes, yes.
Firstly, hi, Noshima.
Hi, Jamaica.
So I've been in therapy now for almost 5 years. And I found that I not only needed therapy, but I needed medication at the same time to coexist together for me. Can you talk about how you let your patients know or clients know that that having both is really not necessarily a bad thing, and how do how do you explain that it's like a well-oiled machine of them going well together versus like maybe one or the other?
Okay, so how like spirituality work with or therapy or coaching works with therapy?
Well, how
therapy
and I guess like
Your
medication also is another additive to
Mhm.
that, where I think I was speaking with my therapist, and I've been able to come off of 2 of the 3 of my meds. One of them I'm tapering down, and I made the comment to her like, I I really want to be off it altogether. And she said, but why? I'm asthmatic, as you know. And she's like, do you make a big deal of being off of, one of your medication? I was like, no, I need it. And she's like, so what is the difference? So how do you encourage those that that in addition to the talk therapy, that there's also like a medicinal component to it, and that it could be a benefit as well?
Yeah. So depending on, and most of the time with regard to that, it is usually a mood disorder or anxiety disorder. And when it comes to mood disorders, we know directly that we have norepinephrine, we have serotonin, we have dopamine, we have those things like when we eat chocolate, and see, I usually eat chocolate every night, but when we eat chocolate, dopamine is naturally released in the brain. That's why we really like chocolate. So I try to explain to them that some people actually have chemical and biological changes where they don't get enough of one or the other of one of those neurons that they need to maintain either their mood. Sometimes when it comes to anxiety, there's been traumas that have been so severe that medication is needed until we can get to a more stable place with the traumas. Now you're leading me into one of the treatment approaches that I like so much that actually really works for a lot of trauma. It works for depression. So most of the things that happen to us that we usually either need to seek therapy for, or just if we look at some of the way how we've adjusted and managed things through life, most of the things that have happened in terms of our belief system about it, it has happened by the time we were 10 years old. And so the training that we implement, that is called EMDR, eye movement desensitization reprocessing. So the format that we use, we help clients develop and figure out what their negative core belief is. What is that thing about you that you feel is driving some of your ways that you're thinking about things, some of your behaviors. And most of the time, and I can give an example of, I can use myself for an example, right? So one of the things that when I process, I had a work-related situation where I was questioning, like logically, I know I'm smart, I know I have degree, I have great experience, I know all these things logically, but yet every time I'm at the table at work and I'm giving and it's being shot down, it's being ignored, or I'm invisible when I'm sharing things, I began to kind of feel unsettled about like, what in the world is it? And it starts to make you question your capacity. So one of the things when I began to process, which was a situation that happened, which was a very light, I thought light processing situation, right? About not being good enough, right? Well, when I started processing what it was connected to, what came up initially was being only African-American when I was in college. It was connected to that in a lot of my classes. And then we went further and it was connected to something that my mom had said that she meant no harm over, but I dropped one of her great, beautiful dishes. And she kind of made the comment of, oh, it's because you're left-handed. And that was the touchstone, we call it the touchstone. So that happened when I was like 8 or 9 years old. So that's what that first inclination of encoding of me questioning, am I okay? Am I good enough came from. So now when you have that work situation, even if it was minor, it's gonna have a whole lot of sting with it because it's connected neurologically to what happened when I was 8 years old. So everything that happened since I was 8 years old, there is not everything, but there are a lot of experiences or several experiences that probably happened that supported and confirmed that questioning that I had about, am I good enough? Am I okay? The being the only Black in several classrooms in college for 4 years straight, like that, having the incidences where you're being questioned, all those things supported that initial thing that happened when I was 8 years old. So that's what we try to help people figure out, what it's connected to. And when we can help figure out what it's connected to, we reprocess with bilateral stimulation, but we help you come up with a more adaptive way of thinking about it. And I think that mine was, I was more than capable and okay as I am, is what I ended up on the adaptive. And then we desensitize that with a bilateral stimulation, which is either eye movements or tapping, which is shown to really reduce the level of emotional, I call it the emotional sting out of the things that we've experienced.
Great, thank
Some
you.
people do need to be on medication long term. Yeah.
Yeah, thank you.
Mhm.
And I want to say that, feel free if you have questions, continue to put them in the chat. Noshima and I talked about this ahead of time, of course, before we met today. And as she already mentioned and alluded to, sometimes their coaching and therapy for her and others, sort of overlap. But then, there are some folk who may not be in the therapy bucket, but you do find yourself stuck in certain situations and not able to move forward. And as she mentioned, those negative beliefs or just not being able to get clarity. And I think sometimes people, just sort of accept that's just the way I am. And, to the question around how do you know if you need therapy or how might you know a coach will be a good option for you is beginning to explore and ask yourself, what are those areas? Are there areas in your life where you feel like you've been stuck? And, it could be stuck in a career, but it can be stuck in a way of thinking. It could be understanding that and you may or may not even recognize this, that you are stuck in a way of thinking, or even to what Noshima just mentioned, coming to understand what has impacted your thinking or the negative or the just playing small or the imposter syndrome or whatever. But if there, I like to say that if I call myself consider myself a transformational impact coach. And it's all about changing the way you think, changing the way you process in a way that will help you to move forward and accomplish goals, vision, purpose, career changes, moving forward. And then one way that I in my training that we learn to distinguish the difference between coaching and therapy is coaching is about understanding where you are now. What is that stuck place? And how do you want to move forward? Therapy is, you may be in this situation now, but in Noshima's example, you had to go back a few steps to try and figure out and dig in, where did that come from? What was the origin of that? And then trying to understand that and then, coming out and moving forward. I think in terms of coaches, and I think something we don't, well, I think a lot of people just don't know what coaches do and what is the benefit of coaching. But I think one thing to understand that there's a distinction between therapy, coaching, mentoring, and counseling. They're all different. And if someone comes to me as a coach and I stay in the coach realm, as Noshima said, sometimes with all the other hats that I wear, I will say to you, okay, I'm stepping out of the coaching realm. Is it okay that I move to counselor or minister? Is it okay that I move to, mentor? Because as a coach, I'm not telling you what to do. I'm not giving you answers. The skill of coaching is listening and being able to ask you the right questions so that you can come to your own conclusions and understanding what you need, because that way you maintain the power over the direction and the future direction of how you want to shape things in your life. So we as coaches, we consider ourselves as sort of coming alongside of you and partnering with you to help you to be able to move forward. And, I think about, like I said, it could be career changes, career coaching, leadership, executive, limited beliefs, fear, all of those, any of those things that you find yourself sort of stuck in. I think a lot about churches and clergy and pastors who I think could really benefit from coaching if they would just be open enough to. One thing about coaching, I think the same thing with therapy. You can't come to a coaching session and not be truthful. In fact, that's a part of our contract. You got to be vulnerable. You got to be transparent. You got to be willing to go wherever the questioning takes you. And it doesn't, it may bring some tears. It may bring some hard questions. You may not know the answer. We'll give you time to breathe. We'll give you some homework and whatever. But the goal is to make sure that you're moving forward. For me and my role as coaching, I am all about women, um, um, supporting women, and no more abandoned, lost dreams, no more playing small. I've worked at Duke for 25 years, and I've had some experiences, much to Noshima's um, example. I was at UNC for 6 or 7 years as well. Um, and we have a lot to offer the world. And it is my desire that none of us leave any of it unturned, not accomplished. So I'll just say, if you or anyone else, and something else Noshima and I talked about, for us as coaches, I don't know about for always for therapists, but for us as coaches, we tend to offer a free session. If nothing else, you ought to take advantage of the free first 30-minute or 1 hour session, and just to sort of understand what's going on and see how it might be helpful for you. I saw a hand, Taylor, let's hear from you. Where you are? There you go.
Yeah, I had a more practical question from the front end of things. As I think most people on the call, Black women, Black Christian women, what are some like practical and helpful ways to help find therapists? Because I think you have to think about like everybody who has a degree isn't necessarily qualified. And then if I am a believer, are they a believer? And so I think that can be overwhelming, especially you may be to the point where you say, hey, I think I might need therapy. But if you get on Psychology Today and you just see a bunch of names and faces, so what are the actual, like, what are good identifiers or things to look for when we're looking for therapists?
Yeah, sure. So one is looking at the profile and what their profile statement is. Reading those statements tell you a lot about the therapist and how they approach therapy. So are they only using a specific 1-2 approach, or are they client-centered, where they start where the client is and allow you to, guide what you want to work on? The other thing is usually they will list specialty areas, because I was going to say, other than word of mouth, in terms of if you know a therapist and they can refer someone else that they work with, that may be your best way to find an actual good fit for anybody's particular personal needs. But in general, on those profiles, looking at the specific things that they work with. And now they've done a lot with, trying to include BIPOC. I was on one and I was so confused because they were saying BIPOC, but they clearly didn't appear to be of any ethnic descent at all. So now you have, people using that but really what they mean is they see BIPOC clients, but they're not themselves BIPOC. So trying to figure out the identity of the therapist and if that's something that's important to you. But looking at those specific things and reading their statement. And if you go to their websites, that's the other thing. When I find a therapist, I like to go to their actual websites and see what's on their website about them, about their practice, and how they serve. And the other thing is, if you get a call or email back this day and time, that's probably a therapist that you should strongly consider if all other things work, are of interest to you. Looking and asking specifically about whether or not they are Christian and do they provide services from a Christian standpoint. That may be something, sometimes that's written and sometimes it's not on there, but a lot of Christian-based therapists, they will put that in their profile information.
Okay, Javasia, that question?
I'm gonna say I found mine through Psychology Today, but this is actually where my faith had to play a role. And prior to finding Laura, like I went to God and said, like, these are the things I'm going through, what my struggles are. And I need someone that you have put in this position to help me with what I'm going through. But also believes in you. So when when I started to scroll, honestly, I was looking for someone who looked like me. And so I found myself just like kind of going through and quickly was eliminating people. But then, um, of being told this one, I was like, the white blue-eyed lady. I don't know if like where's our relatability? And they said it wasn't about the relatability, but about her purpose. So when I met with her, I had questions for her, and what there were a few things that like really solidified it for me. And one was asking when I said, are you a believer? And she said yes, and I said, of God. um, and not only of God. Do you can you fix me? And she's like, oh, we don't, maybe other people do that, but she said, I don't fix people. And if that's what you are looking for, then I'm not the best one for you, because the only way I can come to this place every day is to know um, that God has ordained me to be in this position. And again, I had shocker of like, this white lady talking like this. And but she she was very, very real. And she said, I think the best way I can explain this is if you were out in the water and you felt as if you couldn't get back to shore, what my position is to be out there with you and to give you the confidence to say, you know that you can do this, and I can give you ways of doing that, but I may not actually be the one to grab you up and bring you back to shore. And she then said, like, out of a funny, I do cuss a little bit, so I was like sold. So that worked for me too, because I needed like the realism, the down to earth. I needed the spiritual person, um, and I thought I needed relatability, but it wasn't so much a relatability for me as it just was what I was going through at that time. She has been able to navigate and put that hat on for whatever it is that I'm going through at that time. And someone says 5 years, like you haven't got fixed yet. Well, life is going to keep lifing. So I have to continue to talk to someone, even if it's not of something major, of just someone that is outside of my friends, my family, and saying like, hey, this is what's going on this week. And she says every time, what would you like to talk about, today?
Yeah.
If I haven't already let her know what it was.
Yeah, that's awesome that you have a great relationship and that you were open and you listened to the process to get a therapist that where you connect and that you're receiving benefit from. And when Minister Blake shared that she does the free session, that I gotta say that is a value. You won't get a free session with any therapist that I'm aware of. You might get a free 15-minute consult, right? We were doing that. We stopped doing that just because of the time. And then I'd rather do my consult once you've had some investment in what we're going to do to move forward. So you complete the paperwork, you read over our office policies, you read about myself and my husband, and you feel some sense of connection that you're ready to move forward. That's when folks get our consult with us. So we were doing it on the front end, and we were just spending, I was doing them all for both of us. We were spending a lot of time. So when she told me that she does a free session, that is a great value that absolutely that everyone should be able to take, even if it's just exploratory, to see how can coaching benefit me and how can I move forward. When we talked on the phone, when we were planning about this, one of the things that we thought about for an example, and I'll use this, was procrastination as an example of how to delineate between whether or not you need therapy or coaching, right? So we take this thing of procrastination, and right away, Minister Blake started naming some things. It could be lazy, it could be prioritizing, it could be fear or just no interest. Maybe they're over the job and they're ready to go somewhere else. Those are things that are more in line with coaching and setting goals and how to move forward. But therapy may be needed if it's somebody's at work, but they're disassociating. So they're there physically, but they're really staring off into a memory or trauma that has happened for a large part of the day or much of the day, or they're unable to sit still and get their work done because of anxiety. They have this overwhelming anxiety, or they have a low mood and they're just not motivated to do the job. So they are procrastinating because they're really not motivated because their mood is low. And that whole negative self-doubt could be something that is from an early childhood things. And that may be a reason that how to delineate whether or not it's therapy that's needed or whether it's coaching needed. I don't want to say more serious, but maybe something that needs a little bit more direct attention around a specific kind of thing that's holding a person back.
And I will just say, and Janice will come to you next, and just everyone know we're coming to the end of the hour, but then it is a possibility that you could have both going on at the same time. And so don't discount and think it's one or the other. As Noshima said, things that have a clinical diagnosis, I think you definitely want to give attention to that, because that might be impacting your ability to move forward and accomplish other things. So, but just do keep in mind. Janice, your hand.
Yes, so I have a question for you, Noshima, and you touched on this a little bit in the very beginning, I think, when you were right after your introduction, and you were just speaking of how we have now we overly use certain words. I think one of them was bipolar, and I think you mentioned another. And I have to say, I have to agree with that. I think in the stigma, I think you were just talking about the stigma of why people sometimes don't want to seek therapy. And I think that's very prominent in our community. Can you speak a little bit more about that and other ways that we should just be mindful when we're using terms, and it's not to be harmful, but it can cause even more harm, such as saying the weather's acting bipolar. That can be
Right.
very offensive. And we hear that often, right? But that's very offensive to someone who is battling with being bipolar.
Yeah.
And there's others I know, but can you just speak a little bit to that, just to make us even more mindful and aware of how it can seemingly be innocent, but can be very harmful?
Yeah. So I mean, for me, I've been let out of the box, so to speak. Working for yourself in your own space, you do feel a lot more sense of freedom to do things. And I do find myself, but doing it in the right way, where what I would do is share and really ask, or really just say, it may be harmful or hurt someone's feelings if we use something that could be serious for somebody else in the way that you're using it. Can I offer another way to say it? That's how I would approach it with whatever it is. Narcissistic, right? So from that's one where that term has gotten overused ever since the last the last president we had. That term became very just overused. And I hear people using it a lot. And sometimes I'll even say, without in a lighthearted way, because you don't want it to be serious, not being mean or anything, but I'll say, do you know there's about 9 criteria that someone has to meet before they can have that diagnosis? It's really hard to have a diagnosis of narcissistic personality. It is a lot of criteria. So same thing with borderline, any personality disorder, there's at least 6 to 9 different clinical criteria that they have to have for a sustained period of time that's going to make them have that diagnosis. So for us to use it lightly is a little offensive, right? The other thing is I'm working on myself, even having better language around mental health disorders and how we say it. And for example, someone's not schizophrenic. They may be affected by schizophrenia. So saying someone is affected by a particular diagnosis is a lot less stigmatizing. So someone is affected by bipolar disease may be a better way, a less stigmatizing way to say some of those things. But usually that's how I will handle. I would be very practical in that way in saying, you know, it may be harmful to someone if someone was standing here and they actually do have a diagnosis of bipolar.
Great, thank you. We're at the top of the hour. It seems like it went by fast. Oh, there was another question in the chat, Noshima, if you can address that question. I think Carissa was Carissa, can you speak about the benefit of having community mental health first aiders?
Oh my goodness. Yeah. Ooh. So community first aid, mental health first aiders. So my understanding of community mental health first aid is to be able to let someone know, right? Like to assess that there's a need very quickly and then to get them to ongoing mental health. So mental health first aid, who asked that question? I was gonna say, are you speaking more to something that is, okay, Carissa, something that's a lay person? Yeah, absolutely. I have some practical things. I'm gonna pull it up that I like to share with people to kind of assist, right? Some practical assistance, because I know there's trainings and people could do to be like applied mental health first aid services. So one of the things that you can do, anybody can do this, right? When you think someone may need some mental health services, is the what, when, and how, right? So state what you see. I noticed you seemed down for a few days. I noticed that you've been disheveled. And before you do this, you want to approach the conversation with calmness and concern and care, right? So state what you see, when you noticed it. So I noticed that, you seem down now for the last few days. Can I assist you? Or how can I support you right now? So with that, assisting is kind of knowing some places that you can refer someone to. So if it's your county mental health access point, kind of having some place where you can either call or they can call and then get some assistance. That's some kind of basic practical things that anybody can do to help someone get help. The other thing is, of course, calling 911. And now we have, I forget, I'm sorry. I think it's 711. I think it's 711, where it's the international number now that we can, you will be connected with someone who will connect you with mental health services in your locale. I'll try to look it up because I'm thinking it's 711, but I'm not 100% sure that that's the number.
Well, great. Thank you all. Thank you all. Someone put in the chat is 988.
Oh, okay. Thank you. I was just trying to Google it. Yeah. 988. Okay. Yeah.
Well, Noshima, thank you so much for all the information and answering all the questions. We thank you to all of you for joining this time around, and I really hope that you will join us again next month. I would really love to hear, I put in the chat if there are topics that you would like for us to bring to the table. Please feel free to email me. You can put it in the chat now if something comes to your mind, but feel free to email me with some suggestions. Otherwise, I will let you know what other topic we come up with next month. So let's talk about it once a month, and certainly feel free to share with others and invite others to come and join us. I appreciate your time. I appreciate all your comments, and we just look forward to seeing you all again. Everybody have a really great night. If I don't have your email address, make sure you send me the email. That way you will make sure you get the invite for the next one. All right. Noshima, thanks so much.
Hey,
We'll see you soon.
Okay. All right. Bye-bye.
Good to see you, Noshima.
Good to see you, Carissa.
Hey,
It's been a long time. Hey, I know.
Bye.
Hey, Yana.
Selfishly speaking, that wasn't long enough.
Hour never is. Oh, hold on.